My name's Mwamba Joan Katema, medical officer. I work at Mahatma Gandhi Clinic in Kabwe district of the Central Province of Zambia. I studied a Masters of Science in Diabetes, and I completed my course in early 2022. So the course that I studied was purely online, and it was very informative. I was able to study with different students from various parts of the world, some of whom were from Europe, others Middle East, Asia, and other parts of Africa. And the way the course was structured, it was really relevant to my study. The case scenarios related very well with the patients that I was attending to, so it really helped with patient management. I would say it's a highly relevant course. After having completed the course that Merck Foundation had sponsored me for, that is the diabetes course, I was able to set up a diabetic clinic. Initially, it was at the clinic where I was at, which was Ngungu Clinic. But then I realized that there was a high number of patients from different catchment areas that wanted to access the service that I was offering. So we decided to move to this clinic, and we maximized the building that we are currently in. It was not being used for quite a number of years, so we decided to convert it into the first ever diabetes ward that we have in this province. And using the current structure, we've been here for 10 months, and we have over 300 patients in our care in the 10 months that we've been in existence. And I've been able to train 2 clinical officers and 8 nurses in the management of diabetes. And one of the things that we have achieved is that we were recognized as one of the success stories for the Ministry of Health in Central Province, and it was covered on national television. So pertaining to my career development, I would say the course offered to me by Merck Foundation was a lifeline, because I really had a knowledge gap in terms of management of diabetes. The knowledge that I had was the one that I had acquired during my undergraduate course. And so now I'm able to manage relatively complex cases, and for those that can afford, I'm able to prescribe state-of-the-art medication, certain advanced forms of insulin that are being used even in Europe and America. We're able to prescribe now confidently. My levels of confidence in patient management have improved markedly because of the course that I underwent. And really, right now, there are very few referrals to the hospital, and you find that patients who initially were being attended to at our 2 main hospitals are opting to come to our clinic to be managed because it's even closer to their homes. So I would say we've helped to decongest the 2 hospitals that we normally refer to. Okay, so in the near future, I hope to set up some satellite facilities within the district. That's in the zonal clinics. That's about 4 clinics where we can replicate the service that we are offering here. And I've been having some discussions with our provincial health director on setting up diabetes hubs in all the districts of Central Province. And hopefully, maybe in a year or 2, I'll be able to further my studies and go for a Master's of Science or a Master's of Medicine in Internal Medicine. Okay, because this course has benefited myself and the community of Kabwe in a remarkable way, I will say I've already recommended this course and several others to my peers, and I'm glad to say that 3 of them are currently beginning postgraduate courses under the Merck Foundation scholarships. One of the things I would say to Merck Foundation is that I believe they're a lifeline. My career was at a standstill, and because of the scholarship that they entrusted in me, I've been able to progress my career, and not only that, I'm now able to offer this super specialty service to the community, who are really appreciative as well. So Merck Foundation has been a lifeline to my community in Kabwe Central Province and myself. Thank you, Merck.